Okay, I have 11 o'clock on my calendar, so we'll go ahead and kick this webinar off. We're really excited to have Kyle Dillard, who's in the Greenville office of Ogletree Deacon, and Michael McKnight, who's in the Raleigh, North Carolina office, talk with us today about workplace safety in reopening South Carolina businesses. So I won't speak much. I'll turn it over to y'all. And if you're listening, if you're an attendee right now and you have a question, you can put your question in the chat, and our two great lawyers, Kyle and Michael, will be reading some of those. And then additionally, you can raise your hand in the Zoom, and we might have some time to call on y'all later. But please feel free to put questions in the chat. And with that, we'll go ahead and get started. I'll hand it over to y'all.
All right. Thanks, Sarah. Am I visible and can I be heard?
Yes.
Okay, great. Good morning, everyone. I'm Kyle Dillard. As Sarah said, I'm in Ogletree's Greenville office. My partner, Michael McKnight, from our Raleigh office, is here with us as well. Michael and I have the good fortune to work together and sort of tag team employee safety and health work for our clients in the Carolinas. We're here to discuss the topic that obviously is on everybody's mind, relating to how employers should prepare themselves in order to reopen and bring people back to work. And for that purpose, we're going to try to hit 4 major points in the short time that we have. And we are going to try to build in some time for questions, and please do feel free to send us any questions you may have. But what we're going to do is start by talking about some sort of high-level steps that employers can take to comply with the ever-evolving set of guidance and rules from various federal agencies and from the state, which obviously, if you've been paying attention to these things, you know can make your head spin because they seem to change on a regular basis. So we're going to take a look at that and try to synthesize a little bit. We're also then going to address 3 specific issues. One is going to be and those are issues that we believe to be of significant importance to clients. One is face coverings at the workplace. The other is employee rights under OSHA and addressing employee concerns in an appropriate way. And then thirdly, we're going to talk about screening and proper handling of suspected and confirmed cases to keep the workplace safe. Now, very quickly, before we jump into the substance, I thought it would be constructive to establish a little context to just go back over sort of where we were and how we've gotten to where we are now in South Carolina. It's hard to believe that it's been almost 2 months, or maybe it may seem longer depending on your perspective. But since March 13, when Government Master declared state of businesses, starting with restaurant closures except for curbside service. Then, of course, the first group of non-essential businesses was closed. Then non-essential retail, which limited commerce to basically groceries, pharmacies, hardware, and big box stores that had 1 or more of those 3 in it. And then, of course, recently, the governor's office has sought to start relaxing restrictions, which brings us to where we are now in trying to navigate the best way in order to do that effectively and safely. Of course, as we know, most retail has been reopened, subject to occupancy restrictions of 5 people per 1,000 square feet, or 20% of legal occupancy. And now we know that outdoor dining is permitted. We still obviously have closures for entertainment, sports and rec, close contact, but I think we all would expect those restrictions to begin easing sooner rather than later. As part of that, of course, the governor has formed the Accelerate SC Task Force, which your chamber president, Mr. Pitts, is a prominent part. And just to briefly touch on that, it is divided into 5 subcommittees for response, protection, government, resources, and information. In the last few days, I believe the Accelerate SC website went live, and it provides it's self-described as a one-stop shop for employers to find resources and information. And I spent a little bit of time looking at it yesterday, and it is quite useful. Accelerate SC recently came out with the results of a business survey, which the chamber published via email. It appears that increasing broadband capabilities is a topic of high interest to many business people in the state, which I'll suggest that we may expect some continued and persistent remote working. And also, if you go on the Accelerate SC webpage, you'll see that DHEC has published a restaurant reopening toolkit, which obviously is pertinent to the current allowances and probably foretells restaurants opening on a more broad basis in the near future. So that's sort of where we are now. Now, I'm going to turn it over to Michael to take a step back and talk about more broadly OSHA's perspective and OSHA's sort of high-level recommendations and how to treat the workplace and treat the COVID-19 risk. Michael?
Thanks, Kyle, and good morning, everybody. It's a pleasure to be with you this morning and to share this information. Kyle and I have both been working with a number of clients across the Carolinas who have been facing complaints and more than that, questions about how to deal with COVID and particularly thinking about returning to work. So that's the purpose of the next few slides here, is to go over the guidance that's out there. And as Kyle mentioned, it changes all the time and it's added to all the time. So what we've tried to do is digest that guidance that's out there, pick out the high points, and provide that to you here today. So one of the most common questions I get, and people are relieved to know this, is that there is no specific OSHA standard or regulation that requires employers to do anything regarding the coronavirus. There is in South Carolina, as there is in every state and in all of the federal OSHA jurisdictions, a general duty clause that requires employers to maintain a place of employment that's free from recognized hazards that may cause death or serious physical harm to employees. Now, in South Carolina, amongst the guidance that's been released, one of the points of emphasis they've made is that they want employers to provide basic workplace hazard education about coronavirus and how to prevent transmission of it to employees. And I think that is a critical component of any return to work plan. And I saw that there was a question submitted a few minutes ago about whether it was essentially does having PPE and does having a plan in place protect an employer from liability. And I guess the answer to that question is it depends upon what you mean by that. From an OSHA perspective, having written policies and procedures in place that are adequate and addressed toward the level of risk that coronavirus presents in the particular workplace should help insulate against any OSHA liability. And in terms of other civil liability, there's obviously the workers' comp bar that usually prevents employees from suing employers. In South Carolina, that's very strong. In other states, that bar it may not be so great, and that may be an area where we see more liability if you have employees in other states. But in general, having a plan in place should be something that would help you show to a court or any administrative agency that you have thought about these issues and that you are dealing with them. And in my experience in responding to these complaint letters that people have been making to OSHA about lack of PPE, concern about social distancing in the workplace, and so on, being able to highlight to OSHA the steps that you have taken and the plan that you have in place, that has been adequate in all circumstances. In my experience is that they've been dismissing those complaints pretty quickly when you make those points in your response letter. And in thinking about other specific OSHA requirements that may relate to coronavirus, the respiratory protection standard may be one. The portion that I highlighted here may be more applicable to healthcare employers than all other employers, but the OSHA respiratory protection standard does come into play, and we'll get into this in a little bit later. It does come into play if you decide to provide filtering face piece mask that's N95 or greater mask to your employees. If you either require employees to wear those or you allow them to wear those, then you have obligations under the respiratory protection standard. And also there's a general PPE standard that simply says that employers or employees should maintain all PPE in sanitary and reliable conditions. So if you're giving employees something that might be considered PPE, you're going to want to make sure that you do that. And I think with anything that you require or permit or recommend that employees do, you're going to want to make sure that whatever you're providing them does not create a greater hazard given the particular job duties the employee is doing, and also the particular nature of your workplace. So you don't want to provide gloves or mandate gloves, for instance, that might get employees' fingers or make it more likely they get caught in nip points and machines and things of that nature. So you just want to be mindful of that. And the same thing if you're requiring masks and so on, you want to make sure that whatever you're doing does not cause a greater hazard than what you're trying to avoid. The next slide, we'll take a look at risk categories that federal OSHA has identified. And so there really are 4 different risk categories. So people in the lower risk category are probably people like me who are sitting here in an office and have minimal contact with the public and coworkers. We're not seeing people on a regular basis other than our clients. People in this category are typically lower risk. Now we have a large immigration practice here in our office, and that's very densely concentrated. And so for those people, we may have to take different precautions than we would take for people on our labor employment side who are simply more spread out and are not so much on top of each other. And so that's just sort of the way that you're going to look at these risk categories and try to make an assessment about which one you fall into, because the category that you fall into will largely control the type of steps that you want to take upon reopening and the type of protective equipment that you may or may not want to provide, and the type of training and education you may or may not want to provide, and whether there are other administrative or engineering steps that you can take as an employer to help prevent the spread of coronavirus. So looking further at these categories, if you look at the medium category, that's people who may have contact with people who may but are not known to be infected, but that's employers generally who have lots of contact with the general public. That might be retailers, people who work in schools, people who travel frequently for business. I think we'll see a huge change in the way business travel is handled as a result of all of this, and I think that will be severely curtailed for an extended period of time. And I think that will probably be the expectation of a lot of agencies in a lot of places, and employees too, that will be the case. And also in I think a medium risk category is people in the meat and poultry industry, and federal OSHA has released some excellent guidelines on how to prevent the spread of coronavirus in those circumstances. And the same would be true of other manufacturing environments, particularly where people are working on an assembly line or around a conveyor and may or may not be able to spread out as usual, or at least spread out with 6 feet of distance as is being recommended. So people in the high category, that tends to be your healthcare workers, medical workers, mortuary workers, and then the very high category is those in those particular categories who are working with known or suspected sources or people who are infected with the virus. And in those particular categories, they are going to need PPE, masks, gowns, the N95s, all of these types of things. And they're going to, those people are certainly going to want to consult an occupational medical specialist, occupational health specialist to help them determine what they need to do to protect their employees in these particular workplaces. So in the next slide, we have highlighted, there's a new OSHA poster, and that federal OSHA has come out with, and a lot of people have said, is it mandatory, is it not? My advice would be to post it if you can. I'm not sure that there's going to be any citations or penalties issued for people who don't post this particular poster. It's available on the OSHA website, though, if you just Google OSHA's 10 steps all workplaces can take, and it should pull it right up. But I thought it'd be helpful to go through these 10 steps because they really are good, solid suggestions, and they obviously come from federal OSHA. So if you're doing these things and it happens to be that you get a complaint from an OSHA agency about what's going on in your workplace, what I always try to do is look at this list and go through them and highlight in my response letter all of the things that the employer is doing to comply with these specific recommendations. And then if there are other more specific recommendations for the employer's particular industry, we want to point those out. Now you'll see some of these recommendations are in bold, and I put those in bold because those are recommendations that the state of South Carolina has highlighted in their guidance, and they've put out a lot of good information in these fast facts that are posted on the LLR website, and you can go to that. But the bold points are the ones that I saw there was a lot of overlap between what South Carolina was recommending, what federal OSHA was recommending. But the top three were encourage workers to stay home if sick, encourage respiratory etiquette, including covering coughs and sneezes, and providing a place for employees to wash hands or that alcohol-based hand sanitizer. And then, of course, we want to limit access to only essential workers to your workplace. And it says, of course, if possible, as we get back up and running, that kind of thing is not always going to be possible. So these are recommendations in that respect. And then establishing flexible work sites such as telecommuting, as Kyle mentioned. I think we all expect telecommuting is going to continue for some time to come for people who can do it, or there's going to be staggered shifts, rotate in the office setting. You're going to see people, I think, rotating. Some people may be working Monday, Wednesday, and Friday, others working Tuesday, Thursday, and then alternating, things like that, to limit the number of people in the workplace. And then allowing flexible work hours, perhaps allowing flexibility on shifts to keep people from being and gathering at the same time. And I'm seeing that a lot of times in manufacturing environments where there's screening out front, retail too, so that we don't end up with a long line of folks at a screening checkpoint or at clock in or clock out. That's a great way to try to limit people there and not have problems with social distancing. The next slide continues with the recommendations from federal OSHA, which is discourage workers from using other workers' phones, desks, or other tools and equipment. The reality is that is often unavoidable. So what they have Clorox wipes, things of that nature, so they can wipe down the phone and all that. Some workplaces still have intercoms and all that. There aren't wireless that don't work on iPhones and Androids and so on. So there's going to be some of that, but and so on. And if they're sign-in things where you've got pens, if you can try to wipe down pens and so on, that's one of the things that's kind of that I've noticed as I've gone to restaurants, that they've done all these sanitation protocols, and then they hand you the so-called community pen to sign the receipt with, and it seems like it undermines all of that. It probably is no big deal in reality, but to a lot of employees, not wiping these things down like pens and these commonly used things, I think could invite a complaint to OSHA, whereas you otherwise might not normally get one. Regularly cleaning and disinfecting surfaces, equipment, and other elements of the work environment, and doing so with EPA approved chemicals, I think is key. Following manufacturer's instructions and not mixing chemicals, I think, are very important. And the other thing is, I think, making sure that you have the safety data sheets available in your workplace for the chemicals that you have. I think one fallout of all of this chemical buying and cleaning material buying that people are doing is that they're going to end up with closets full leftover cleaning supplies when all this is said and done, and probably not have safety data sheets available. And then when an OSHA inspector comes in, they may see that and say, well, let me see your safety data sheets. And if that stuff's not available, you may end up with a citation just because of something like that. So that's just something to think about and consider. And then the last point is to encourage workers to report any health and safety issues. And Kyle's going to touch on that in his presentation in later slides. There are some additional business and work site specific social distancing things that you can do. Some additional, I call them administrative and engineering controls that you can put in place to allow for greater social distancing in the workplace. And I think, you know, for all the safety folks that we have on the phone today, everybody's familiar usually with the hierarchy of controls, and the preference under OSHA is always to use these engineering and administrative controls where you can, as opposed to PPE, to try to eliminate and control hazards. So that's what we've done here, is put together some recommendations that we've been giving to different employers, and that has been taken from the guidance that South Carolina has provided about how to prepare workplaces for return to work. So some of these points include ensuring employees keep at least 6 feet away from coworkers and the publics. And in order to do that, it's important, if you can, to provide markings and so on, so that people know where to stand. A lot of times it's hard to estimate what is. Also eliminate complaints and give people a sense that you're taking it seriously, and that you've thought this thing through, I think is key. And one of the recommendations from South Carolina was that you might possibly consider designating one or more employees to monitor compliance with social distancing requirements, much like you would do with a safety monitor or so on. I have somewhat mixed feelings on doing that. I've seen a lot on social media about these what they call social distancing vigilantes, people who are out there shaming and reporting other people who are not complying with social distancing requirements. I don't think you want to end up with a work environment where that's the case. I do think it may be helpful to have and be able to tell OSHA if there is an issue that comes up, that you have measures in place to make sure employees are actually complying with markings on the floor and so on. And particularly if you don't end up having physical markings or other barriers for employees, you have someone who is looking out and can say, yes, I've been keeping track of this, I've been monitoring this in the workplace, and in fact, social distancing has been honored and has been followed in my observations. And I think that can be helpful in responding to issues that may come up. Other things, avoiding lines and crowds at screening time clocks and meal and break areas. I think we've talked about that already. Staggering schedules is particularly important for break areas and meal areas, and also setting occupancy limits in those areas. What I see a lot of employers doing is letting people go outside where they might not normally be allowed to do that, so they can spread out more. That's a good way of dealing with that. Also installing physical barriers between employees and customers where social distancing is not feasible or possible. I've also had employers do that when employees are working on conveyors. They might normally work across from each other. The employer has usually been able to allow them to work diagonally, but in a lot of cases, they're still not able to maintain 6 feet of distance, and they're working together for extended periods of time, which is usually defined as at least more than 10 minutes. There's some debate about how long that exposure can be, but my advice is, if you've got people who are working in close proximity to each other, like you can't enable social distancing. I've had a couple clients put up things like plexiglass shields between employees, and they can hang them from the ceiling. They can put them on other pieces of equipment if it's safe to do so, and that's a good way to prevent the spread of any coronavirus that someone may have. Also implementing flexible meeting and travel options, avoiding group meetings. And then if you've got situations where employers are riding in company or sort of mass transit vans or trucks or whatnot, allow them to drive on their own or take other transportation, so that you don't end up having too many people grouped together if that's possible. The next slide also gets into, talks about providing and allowing use of PPE and other supplies. One of the biggest areas of complaints that I think we have been seeing here at Ogletree with clients is that people are complaining that, yes, I know that my employer says these things are available, but they're not available. That might be wipes, disinfectant wipes, spray, gloves, particularly masks. I know with supply chain issues that makes these issues tough, but that's something to think about as you go back to work. If you don't have adequate supplies, you might try to make sure that you get those in place where you can before you bring everybody back. I think that's important, just to know that these things are available. Some people are if you're requiring things like masks, you certainly want to make sure that there are plenty of those available. If you're making it a recommendation or just something that employees can do, you still want to make sure that you have enough available. Here are some other recommendations that we have for things that you may want to make available. And then, of course, to the point about keeping the safety data sheets and not mixing chemicals, we've already gone over that. But I think that's a key point to think about as you're using those particular materials. Now, one of the things, the next slides are going to cover face coverings and masks. We've tried to discourage people from calling everything that's a face covering a mask, because masks can have OSHA implications. I've done a couple of different charts here that we'll look at to compare face coverings and masks. And so looking at the left-hand side of this particular slide, of course, face coverings are those cloth or paper face coverings that you see a lot of people wearing now. They're loose fitting. They're not considered PPE by OSHA, and for that reason, they're not regulated by OSHA. There's no fit testing that's required. The goal is to just permit transmission of the virus between people in close proximity, and those particular coverings largely protect other people from you rather than protecting you from other people. The same thing is largely true of a surgical face mask. They're loose fitting, not considered PPE. They're not regulated by OSHA outside of the healthcare setting. They are considered PPE if you're a healthcare employer. So again, you want to make sure that they're clean or sanitary, but any employer is going to want to do that. They do protect the wearer from large droplets, splashes, or sprays of bodily fluids, which is, there is at least a lot of thought that this coronavirus is spread by droplet spread, and this would help prevent that. So it does provide some protection to both the wearer and the other people who are around the wearer. These are used in healthcare often if no N95s are available, and with patients who have suspected and confirmed coronavirus. So the next slide will compare the surgical face mask with the filtering face piece respirators. I think we skipped, there we go. Sorry. Okay, there we are. So surgical face mask, we've already gone over that, but the filtering face piece respirator, that's N95 mask or above, those are the ones that are regulated by OSHA. They're tight fitting. They are considered PPE unless your employee provides them. So I've had several cases where there were office type employees who wanted to bring and wear their own N95 mask. As long as you, the employer, do not provide it, OSHA does not consider that PPE, and the respiratory protection standard does not apply to that, and OSHA is not going to get into regulating that. But if you supply the filtering face piece, N95 or greater, then you're going to have obligations under the OSHA respiratory protection standard, and here's what they are. If there are N95 respirators are provided by the employer but allowed for voluntary use, you have to give employees what's called Appendix D to the respiratory protection standard. I usually just put that on a piece of paper and have employees sign that off. If you have trouble finding that, that's something we can provide to you. And then if you're going to require employees to wear the N95 mask, and that's typically not recommended for anybody outside the healthcare field, but there are, I understand, circumstances where you might do that. If you do that, you've got to go through a fit testing process, and you've got to adopt a respiratory protection program. So for that reason, most employers are staying away from requiring this type of thing. They may both be providing them and allowing their voluntary use, and just supplying Appendix D, which basically says that the person is healthy and able to wear the mask, that they'll check with their medical provider about that, and that they'll use the mask in accordance with the manufacturer's instructions. And of course, the N95 mask is intended to reduce exposure to both aerosols and large droplets, and that is the preferred PPE for healthcare workers, and particularly those caring for patients with suspected and confirmed coronavirus, in addition to face masks and other things of that nature. And I think Kyle's going to pick it up from here, talking about responding to employee questions and complaints.
Thanks, Michael. So Michael touched on the importance of educating employees about what the company is doing to protect employees, the facts about COVID-19, the facts about what can and cannot effectively be done to discourage infection and promote safety. That's very important as it relates to this issue of employee questions and complaints, because on the next slide I have a reference to employee confusion. I think that employee confusion is probably going to be the biggest source of problematic situations with questions and complaints. Why is this important? Well, it's important because under the OSHA Act, it is illegal, as many of you probably already know, to take an adverse action against an employee who exercises their rights under OSHA. And those two terms, adverse action and exercise of rights, can be quite expansive. An adverse action is basically anything that would be recognized, for example, under Title VII as an adverse employment action, probably plus a little more. Essentially, if an employee suffers any sort of diminution or in the terms and conditions of employment, any sort of hostility, anything that's negative, I can consider it an adverse action. And the exercise of rights is very broad too. The most obvious example of exercise of rights is making a complaint to OSHA or participating in an OSHA investigation. But the courts have expanded the notion of what exercise of rights can include to go as far as simply expressing concerns at work to management. And so we have to be careful when we're approached by an employee with a question, and certainly with a complaint about a condition, that we don't engage in any activity or behavior that could be considered adverse action. And I have a notation of the word circumstantial. Unfortunately, even fairly minimal circumstantial evidence of an adverse action can at least trigger an investigation by OSHA, and which at minimum burdens your operations with having to respond. Very quickly, what does it look like if something happens and an employee does complain to OSHA? Well, first and foremost, it's very easy to complain. There's an internet portal for employees to do that. So it is a low investment activity. Once that complaint comes in, OSHA will send a notification to the employer, typically ask for a copy of the personnel file, and ask for a statement of position. Oftentimes, Michael and I end up preparing those statements of position for employers. And the goal of it is very much like an EEOC charge, is to put your best foot forward and try to convince OSHA that there's nothing to see here. Because under 11C, OSHA may actually sue on behalf of the employee for basically equitable remedies to cure whatever adverse action took place. Obviously, we want to avoid those things. So I talked about employee confusion as a fertile ground for these problems. For example, if employees don't understand the current CDC guidance on face coverings, There may be some who don't want to use them. There may be some who want to use them and feel like they're not being provided an adequate opportunity to use them. There's some who may be dissatisfied with only being provided with a surgical face covering. They may feel that they need an N95 mask. It's important to be prepared to address those concerns in an accurate and comprehensive way. But also it's important to be sure to address those concerns in a way that is constructive and empathetic so that the employee is treated fairly and feels like they've been heard and they've received an answer that's meaningful and appropriate. But another problem we have, though, and it gets a little stickier, is what if you can't satisfy the employee? And what if we have a situation where an employee refuses to work out of fear of contracting COVID-19? The OSHA law actually does allow employees to refuse to encounter a dangerous condition under certain circumstances. And those are, there has to be an immediate threat of serious harm or death to the employee by encountering the hazard. The employee's perception of the threat has to be in good faith, and it has to be objectively reasonable, which of course means that a reasonable person in their position would perceive a threat, not that that individual felt that the perception of threat was reasonable. The employer has to have refused to correct the hazard after the request. And in most cases, there has to be inadequate time to involve OSHA, because what the OSHA law expects and intends is if there is a condition on a work site that an employee is concerned about, they should get in touch with OSHA to intervene on their behalf, not engage in self-help. So refusal to work is a bit, under the OSHA law, is a bit of a drastic remedy of self-help, but it is permitted. So the question becomes, how does that fit into COVID-19? Well, generally speaking, a person simply asserting that they're afraid of getting sick by going out in public with no objectively reasonable or identifiable basis for concern can't refuse to come to work. But if we get into a situation where we have an employee who says, I am afraid because it's my understanding that we should all be wearing face coverings and we're not, or it's my understanding that we should all be 6 feet apart and we're not, that employee has a legitimate gripe and it needs to be addressed in a fair and meaningful way. Hopefully in those situations, with information to the employee and demonstration to the employee that the company is in fact doing what it's supposed to do, the concerns can be allayed. But if not, quite frankly, though I know no one likes the idea of involving OSHA in their business, if the employee wants to take the position that things are unsafe and they're not willing to work, you can offer them the remedy of calling OSHA and having them advise on it. And if they choose not to do that and they walk off the job, then they've gone outside of their rights. I have a notation about a Bloomberg report regarding South Carolina Department of Employment Workforce, just in connection with this issue of fear-based refusal. It was reported in Bloomberg yesterday that DEW has put out a statement that refusing to come to work and take employment that is offered and available because of a generalized fear of COVID-19 will be disqualifying for unemployment insurance. I searched the DEW website yesterday, including the link that was provided with the article, and could not confirm that, but it's worth keeping in mind. The next thing I want to talk about is what do we do in terms of trying to keep COVID-19 out of our workplace in terms of screening and testing. As you all probably know, under regular circumstances, The ADA prevents us from making medical inquiries of employees and certainly from submitting them to medical testing. However, the EEOC has determined that the COVID-19 situation falls into the direct threat exception to that prohibition, and therefore has issued guidance that does two things. One, it specifically allows and encourages employers to engage in informational screening. And what I mean by informational screening, as opposed to testing, is talking to employees, and not just employees, but any people who may be coming into the place of business, to determine whether they have been exposed to activities that might make them a high risk for infection, including exposures to people who were infected, including travel, things of that nature. It is recommended and certainly appropriate that on a daily basis, people coming into the workplace be asked a series of questions to screen them for exposure risk. It is also appropriate and recommended that employees who have been away from work and who are recalled to perhaps provide a more detailed set of information than just a set of daily questions. Amongst those questions, it is also appropriate to ask an employee if they are symptomatic and if they have a fever. As noted here, it's important to ensure consistency of treatment amongst all employees. And it is recommended to keep a log of information, but to maintain the confidentiality of the information put into that log. Now, we next get from informational screening to testing. And the one thing that the EEOC has been very clear about is that it is permissible for employers to screen employees for fever before coming to work. As I'm sure you all have heard, the 100.4 degree magic number as being the threshold fever that makes us concerned about somebody potentially being infected with COVID-19. And employers are permitted to require employees to have their temperature taken before coming into the workplace. The CDC has given us specific guidance on 3 options for how this takes place. Now, I'm not going to go through these slides word for word because you can read it for yourself, but I just want to talk about it generally. The first option is the social distancing approach. And in that approach, essentially, an employee either takes their temperature before work and reports it as they come in, or they can take their temperature at work. And it's done in the presence of a person who maintains social distance, observes the employee for any symptomatic signs, and takes note of their temperature. Obviously, the downside of this is, particularly if we're allowing employees to take their own temperature before work, is we're taking their word for it. If we're asking them to take their temperature at work, I think that raises a lot of questions about the thermometers, the instruments, passing them around, things of that nature. So it could be a little complicated. The second option that the CDC has offered is temperature screening by a representative of the company using a barrier or partition control. And essentially what that means is, if you visualize the picture of a person with a thermometer standing behind a partition who can either reach through an opening or reach around the partition and take the employee's temperature with a scanner. The third option is to rely on PPE. So there's no physical barrier between the person taking their temperature and the employee. Instead, the person who's charged with this task is notionally protected by wearing face mask, gown, goggles, gloves, all that good stuff. Now, if you go into detail under each of these options for the barrier and for the PPE, you can see that it gets fairly detailed, and probably from a logistical standpoint, it's fairly burdensome. So the question, at least in my mind, is, though certainly screening employees' temperatures is a great idea in terms of the information that it gives us and the opportunity to prevent sick employees from coming into the workplace, we have to give thought to how we're going to do this. Is it reasonable, given your company's particular circumstances, for an in-house employee to go through this process of donning full PPE or standing behind a barrier and taking temperatures of people as they come in? Would it be better, if available, to engage a third party medical contractor to assist with this? I mean, these are questions that each employer needs to consider. But these are the options that the employer has. Now, one thing that remains a little bit gray is the question of other forms of testing. And what I mean by that is tests that are actually directed towards detecting infection. The general guidance from the EEOC is that employees may be tested for infection. But the EEOC has given us no guidance, and the CDC hasn't given us guidance on specifically what tests are permissible or how they should be administered. We've been told by the EEOC that the test should be reliable and that they should comply with FDA guidelines, and that's about it. The other wrinkle is that there's a difference, as many of you probably know, between tests such as in vitro tests for live infection and the antibody tests that are designed not to screen out people who are infected, but determine if someone has previously been infected and therefore may have an immunity. The EEOC guidance is ambiguous at best as to the question of whether the antibody tests are permissible. One could argue that as a separate medical inquiry, but also, and perhaps most importantly, we're uncertain as to whether those antibody tests are of much utility, because we don't yet know whether having had the virus creates immunity. Obviously, I'm sure many of you have probably heard of companies that are going ahead and engaging in some form of testing for infection. Some of you may be doing it. At this point in time, I think the practical reality is companies are going to do it. The EEOC is obviously given some level of license to do it, but unfortunately we don't have enough guidance, or really any guidance, to tell us how to do it in a way that will be deemed acceptable. So that's going to be an ongoing process, probably particularly as the technology improves and the availability of testing becomes more widespread. So the next slide gives a chance to return the floor to Michael, who is going to discuss, when you do screening and you find out that you have a suspected or confirmed case of COVID-19, how do you handle it? Michael?
Yeah, thanks, Kyle. And I think I saw someone point this out on the chat that, not all cases of COVID-19 involve people with high temperatures or any temperature at all. And I think that's a very good point, which is why temperature screening is really only going to be one part of your protocol. I think the recommendations that I see that seem to make the most sense in this context is for most people to have people take their temperature at home and ask questions about that, and then conduct a standardized questionnaire of those employees about symptoms and so on, and make sure they understand that honest answers are expected and in fact required as a condition of employment. And I think for most people, that's going to be the answer. And I think I saw another comment or question about what about we can't get thermometers, that's a problem. And then what about the reliability of these forehead scan thermometers? Is there anything out there on that? I have not seen anything officially published on the reliability of those particular thermometers, but I would say stay tuned because I think stuff comes out every day. But I think the unavailability of different types of thermometers and questions about reliability, most people at home have the traditional stick it under your tongue or in the ear at least type thermometer, and that's going to be best. And it's best to get people in the habit, and I guess there has to be some degree of trust there that people are actually going to take the temperature before they come into work. But asking people to do that, and then I think following up with a questionnaire is probably going to be the course that most people go. The other employers that I have who are in critical industries and have continued to operate now, many of them have contracted with good and reputable healthcare services to have actually trained healthcare folks take temperatures where they thought that was necessary. A lot of people in the food preparation industry are doing that kind of thing. And I think that's also a good idea. I think having an HR person don a robe and a mask or end up with behind some kind of plexiglass shield trying to take people's temperature, I think that may sound possible, but probably may not be a good idea for a lot of reasons. But to the extent that's done, that's what the CDC guidance is for. But in any event, the idea is of all of this is to require people to stay home or go home if they feel or appear sick. And then, of course, South Carolina and the federal guidance all says that you want to make sure you identify and isolate those workers who exhibit signs or symptoms of the virus. I think it's important in a lot of workplaces where people may take public transportation, rely upon someone else for a ride to work, to make sure that you have a place for people to go who start feeling sick or need to wait for a ride or whatnot. Most folks are probably just going to go home if they drove themselves, and they're not going to need a place to go. But I think you need to think about whether there is a place that people can go if they need to wait on someone to come and get them if they get sick at work. And then you're going to need to hopefully that's a small area that can be disinfected after that person leaves. Now, in terms of looking for symptoms and so on, those symptoms seem to be changing almost weekly. We've put a link to the CDC website. Those are the symptoms that I would recommend that people go by in conducting this screening. And if to the extent that you're adopting policies and all that, I think it's hard to list certain symptoms and stick to those, because as we learn more about the virus, that certainly changes. I think it's fine to incorporate just the CDC guidance in that. And also, after someone has been, there's been a case of suspected or confirmed virus in your facility, and I've had several people who've had that happen, you just want to follow the CDC deep cleaning guidance in terms of cleaning behind in areas where that person was, and then getting other employees out of those particular areas. The CDC has some great guidance, multi-page guidance on handling deep cleaning, both in those particular circumstances and if you've been closed, thinking about deep cleaning before you reopen and after you reopen at that particular web link. And so and I guess this is a good point to address a lot of the questions related to, are we going to make the slides available after this presentation? That's certainly fine with Kyle and I, and we will do whatever we need to work with the chamber to make sure that they are available for you. I know it's impossible to take notes on all this stuff, and it's also for these slides that have the web links on them, it'd be good to have that in front of you. So absolutely, we'll make the slides available for everybody after the program. So the next slide, I believe, ties into those cases where you have suspected or really confirmed cases of coronavirus in your workplace. OSHA, of course, has recording and reporting requirements under the OSHA record-keeping standard, which is the 1904 standard, employers are required to record work-related injuries and illnesses that result in days away from work, a job transfer, or medical treatment beyond first aid. And illness is work-related if it's more likely than not that a factor or exposure in the workplace caused or contributed to illness. And unlike the common cold or flu, which OSHA specifically exempts from being on these logs, they have said COVID-19 cases are recordable where there's clear evidence, there's objective evidence that the employee was infected on the job, and there's also the employer has reasonable access to information to suggest that a particular employee was infected on the job. So I think if you have a case where it's just a one-off case where an employee is infected and they've been traveling or they've been at home, that kind of stuff, then that's certainly not a case that you're going to be required to record on the OSHA log. I think you're just going to have to look at the circumstances. Federal OSHA did come out with some guidance in mid-April that basically said that there had to be clear and objective evidence before an employer was required to record those particular circumstances. I don't know that that guidance necessarily changed a lot because that was always really the case, but I think it in some sense relieves employees of the burden of having to do some extensive analysis about whether a COVID case is work-related. Obviously, if you have a string of people, as we've been seeing in some of these meatpacking facilities across the country, acquiring the virus, and they've been working together, then I think in those particular cases, we're going to end up with situations where you're going to need to record, but probably you may not need to record the first case, but you might need to record subsequent cases. I think all of those calls are calls that you make on a case-by-case basis, and of course, the guidance on relaxed recording does not apply to healthcare employers. So healthcare employers will need to record really all of those incidences that may potentially be work-related. And recording requirements are similar to reporting in that both recording and reporting require a work-related illness to be work-related. So you're only required to report this, and when I say report to OSHA, I mean calling in or reporting through the OSHA website positive test. There's been a lot of questions about this. People thought they were supposed to call OSHA and report employees with positive tests generally, and that is not the case. You only have to report it where an employee is hospitalized as an inpatient within 24 hours of being infected. And that's only if there's evidence that they were infected in your workplace, or if they die within 30 days of being infected in the workplace. And what I'll say for the inpatient hospitalization requirement is usually if someone does not immediately go to the emergency room, which is not usually the case with COVID-19, they are not going to be inpatient hospitalized within 24 hours of being diagnosed with the virus. So it's very, very rare that I would think, if ever, you would end up reporting to OSHA inpatient hospitalization. I think the only time might be is if someone ends up dying of the virus and it's clear they acquired it at your facility, you'd want to call that in and report that to OSHA. So far, I haven't seen any particular instances of that. So with that, I think we'll look at really the final substantive slide that we have here, which is just a link to our Coronavirus Resource Center. And that's got a collection of all the blogs that we've been doing. You can sign up for a daily coronavirus update just in case you haven't been getting enough coronavirus news lately. You can sign up we have daily updates where we go through the latest developments on all of this stuff, and you can certainly do that. If you have any trouble signing up for either of those things, you're welcome to call either Kyle or me, but I think you'll find the Resource Center very helpful. And we also have developed a return to work packet that's been well received by a lot of clients. It has materials, forms related to anything from temperature screening to questioning employees about symptoms to all of these other things. And it's all together in one package, and you also get some time with an attorney to discuss those things. So we also have that available. I think in terms of, and I know several questions have rolled in. The only other one that was in my section so far that I think that might deserve some clarification is on the safety data sheets. think someone asked whether if there are common household chemicals that you're using for cleaning, do you have to have safety data sheets for that? What OSHA says is that you do not have to have safety data sheets if you're using common household cleaners in the workplace and they're used in the same proportion, same amount, the same way that employees would use them at home. My experience though with that is a lot of times those are intermixed with commercial grade cleaners, or they're used in amounts that are in excess of what you would see, or employees are exposed to amounts in excess of what they would normally be exposed to in their home environment. For that reason, OSHA will take the position that you should have had the data sheet, or someone gets Clorox in their eye or whatever, and there's a question about whether that data sheet should have been available. My advice is, if you have a chemical in the workplace, get the data sheet available, because the time and energy taken to get that together is very low compared with the time and energy taken to fight off a citation if you happen to have somebody in your work, OSHA inspector in your workplace who hones in on that particular thing. So with that, I guess we'll turn it back over to the folks at the chamber to determine next steps.
Thanks, guys. That was very helpful. I think y'all have answered most of the questions that are in the chat. Anybody who has not had their answer or their question answered, please feel free to email us, and we will get that to these fine attorneys over at Ogletree. And if you have any questions, we'll probably be sending out a recording of this later, as well as the slides, as was mentioned. So thank you again to Ogletree Deakin and for hosting this, for doing this for us, and thank you to Kyle and Michael. And again, we will, if you have any other questions, feel free to message to us, and we will get those to them.